Bismillahirrahmanirrahim. Quote of the day: start each day with a positive thought. Today, I present the critical appraisal under kind supervision of Professor Dr. Saira Afzal by using a gathered checklist. And the title of my research topic is Burden of Neurological Disorder Across the US from 1990 to 2017, a Global Burden of Disease Study. And we are using the Gather checklist for our appraisal. And the Gather stands for Guidelines for Accurate and Transparent Health Estimates Reporting. The Gather checklist is the checklist of 18 items, and the domains that are covered in the Gather checklist are the objectives and funding, data inputs, data analysis, and the results and discussion. And now we are find out the these heading in our research topic, and then critically appraise the our research topic. And this is the abstract in which the objectives you can see are clearly mentioned: to present burden estimate of major neurological disorder in the US state by age and sex from 1990 to 2017. And then the design, setting, and participant. This is a systematic analysis of the global burden of disease 2017 and the data on incidence, prevalence, mortality, and disability adjusted life years of major neurological disorder were derived from the global burden of disease 2017 study of the 48 contagious US state. So this is the structured abstract. And in the results section, the three most burdensome neurological disorder in the US in terms of absolute numbers of disability adjusted life years were stroke, Alzheimer's disease and other dementias, and the migraine, and the burden of almost all neurological disorder in terms of absolute number of incident prevalence and fatal cases, as well as increased from 1990 to 2017, largely because of the aging of the population. And then is the conclusion and relevance. There is a large and increasing burden of non-communicable neurological disorder in the US, up to 5-fold variation in the burden of entrants in particular neurological disorder across the US state. The information reported in this article can be used by healthcare professionals and policymakers at the national and state level to advance their healthcare planning and resource allocation to prevent and reduce the burden of neurological disorders. So you can see that in the title is clearly mentioned the study design and their purpose of the study, and the abstract is the structured abstract with background, objective, design, results, and the conclusion. Now comes the introduction section of the study, in which the previous global burden of disease, injuries, and risk factor study article have reported burden of disease, injuries, and risk factor among US state, global, regional, and country-specific estimate of the burden for neurological disorder, but no estimate for a comprehensive list of neurological disorder have been reported in the US state from this study. Globally, regionally, and at the country level of analysis, the burden of all non-communicable neurological disorder in terms of absolute number of people who had remained disabled or died from them. So you can see that in the introduction section, they can clearly mention the study gap and the objective of their research. So objectives: define the indicators, population, age, sex, and geographic entities, and time period for which estimates were made. List of the funding source for the work are mentioned. The study was supported by Bill and Melinda Gates Foundation. And in the methodology section, details on the methodology of the GBD study overall and in association with the burden of neurological disease have been published. In brief, using statistical modeling technique, the GBD study allows use of all available epidemiological data, both published and unpublished, and routine collected data, vital registration, hospitalization, medical claims within and just outside of the country, region, or state of interest to provide the most accurate estimate of the disease burden, even for regions or state with no accurate epidemiological data. Non-fatal estimates were obtained from systematic reviews, survey, administrative health record registries, and disease surveillance system. And the fatal estimates were obtained from vital registration data, death record from the National Center for Health Stats, and population counts for the US Census Bureau. So you can see that in the methodology section, they clearly mentioned the source of the data inputs that were used. For all data inputs from multiple sources that are synthesized are the part of the study, describe how the data were identified and how the data were assessed, but there are no inclusion and exclusion criteria present in this study, and provide information on all included data source and their main characteristics are present, but they identify and describe any categories of input data that have potentially important biases are not described in the methodology section. For all data inputs, provide all data input in a file format from which data can be efficiently extracted, including all relevant metadata listed and item. Now comes towards the results section. The 5 leading causes of death from neurological disorder were from Alzheimer's disease and other dementias, stroke, Parkinson's disease, motor neuron disorder, and multiple sclerosis. The highest incidence was of new onset followed by migraine, traumatic brain injury, stroke, Alzheimer's disease, and other dementias. This is the temporal trend of these neurological disorder, and in which you can see the some diseases acquire the plateau phase and some showing the decreasing trends, and the 5 diseases showing the increasing trend, and the disease that are showing the increasing trend are mostly non-communicable neurological disorder, and the communicable neurological disorder are decreasing in their trend due to advancement in the primary prevention of the diseases, primary prevention in the communicable diseases. And in the result, they provide a conceptual overview of the data analysis method, but there no diagram present in the result section. Provide detailed description of all steps of the analysis, including mathematical formula, age standardization rate. This description should cover relevant data cleaning, data pre-processing, data adjustment, and weighting of data sources, but they cannot describe how candidate models were evaluated and how the fine models were selected. And they also not provide the result of an evaluation of model performance if done, as well as the result of any relevant sensitivity analysis. They describe the method for calculating uncertainty of the estimate, but they cannot state which source of uncertainty were and were not accounted for in the uncertainty analysis. They cannot state how analytical or statistical source code used to generate estimates can be assessed. In the discussion, to our knowledge, this is the first comprehensive report in the incidence and prevalence, mortality, and daily estimates and their trends from 1990 to 2017 for 14 neurological disorder for the individual 50 US state and the country overall. The study show reduction in the age-adjusted rate of most burden metric of stroke, Alzheimer's disease, and other dementias, traumatic brain injury, spinal cord injury, and meningitis and encephalitis. But increasing number of people affected by various neurological disorder in the US, with a significant up to 5-fold variation in the burden of and trends in particular neurological disorder across the US state. Falling rate of stroke, Alzheimer's disease, and other dementias, traumatic brain injury, spinal cord injury, meningitis, and encephalitis might suggest because the primary prevention of communicable diseases are strong nowadays. So in the results and discussion, they provide the published estimate in a file format from which data can be efficiently extracted, report a quantitative measures of the uncertainty of the estimate in the form of uncertainty intervals, interpret results in light of existing evidence, Discuss the limitation of the estimate, include a discussion of any modeling assumptions or data limitation that affect interpretation of the estimate. So in the limitation, specifically for this report, we were not able to provide burden estimate for all neurological disorders combined or burden estimate by age and sex, because these estimates will be the subject of separate report. In addition, some very prevalent neurological disorder like restless leg syndrome and peripheral neuropathy are not currently estimated by this global burden of disease. And some other limitations are difficulty in determining death from dementias, lack of data to quantify headache in the US, accuracy of medical claims and hospitalization data, and potential inaccuracy in the adjustment of administrative data, those reported in epidemiological studies. So in the conclusion, healthcare professional and policymaker at the national and state level can use the information reported in this article to advance their healthcare planning and resource allocation, including research funding to prevent and reduce the morbidity and mortality of neurological disorder. And the strength of this research is they define the indicator population, including age, sex, geographic entities, and time period for which estimates were made. They describe how the data were identified and how the data were assessed, mention the funding source for the work, provide published estimate in a file format from which data can be efficiently extracted, interpret results in light of existing evidence, discuss the limitation of the estimates. However, it does not provide any inclusion or exclusion criteria for the data inputs. This is our YouTube channel. Please like and subscribe, where we upload all the presentation by the PGR conducted in the Department of Community Medicine. Thank you.